and welcome to They Say It Takes a Village. My name is Raya. I've got 2 little boys, a full-time job, and now I'm adding amateur podcaster to the mix. So it's safe to say that it really does take a village, at least for me to raise my kids. This podcast is aimed to give moms a fun, unfiltered, and an informative outlet to navigate all things motherhood. Join me each week as I interview one of our local heroes from my village who make mom life just that bit easier. Think of me as your personal mom group, bringing you recommendations when you need it the most. Having said all that, let's get into today's show. They say, why fit in when you were born to stand out? Hi, everyone, and thank you for joining me on another episode of They Say It Takes a Village. On today's episode, I'm going to be joined by Lighthouse Arabia's clinical psychologist, Ms. Preetha Madhavan, and we'll be discussing autism. What are the signs, how to potentially diagnose it, and the support that you can receive as a parent and for your child. Preetha, thank you so much, and welcome to They Say It Takes a Village. Do you want to tell the listeners a little bit about yourself, how long you've been in the UAE, and what you practice?
Sure. Well, thanks for having me.
Oh, my pleasure.
So my name is Preetha Madhavan, and I work at the Lighthouse. I'm a clinical psychologist, and I specialize in working with children and adolescents, and I do a bit of parenting work as well. And autism for me is an area of special interest. I've done my training recently, and so I'm here. I hope I can share a bit of my knowledge that would help your audience.
Absolutely, it will. I will. I feel like with this whole area, there's so much information with very, very little direction. I think if you go online and you research anything to do with this area, you've got so much information out there, and parents or people don't really know what is going on, really.
Absolutely. And it can be quite overwhelming.
Yeah.
You know, there's, like you said, there's so much information there. You don't know kind of what's relevant, what's not relevant. And also, I think locally within the UAE, there isn't as much sort of awareness or information out there that people can sort of, know whom to contact or what they need to do. So I can see how it can be overwhelming. So I'm really hoping that, through this, we're able to, yes, create the awareness, but also probably help out those parents that might be seeking some direction or some support.
So I guess, to jump straight in, my first question would be, what is autism? Or, as I understand, it's autism spectrum disorder.
Yes. So, we call it autism spectrum disorder because it is a spectrum, and I don't think a lot of people are aware of that. So, we do have the low functioning, but then, it goes along the spectrum, and there are the high functioning children or people on the spectrum as well. And I will talk about that in a second. But answering your question as to what is autism, it is a developmental condition. It's a neurological condition, and it's characterized by sort of difficulties in social communication, sort of that restricted and repetitive patterns of interest. And so, like I said, it's a neurological condition, and again, depending on the level of functioning, a child can be either low functioning, so that would be like limited language, possibly an intellectual disability. And then as we move along the spectrum, there are the high functioning, people on the spectrum, which used to be called Asperger's.
That was my next question. What's the difference?
So Asperger's is a way of, describing people on the spectrum that don't necessarily have the, that sort of intellectual functioning deficits. And really their biggest sort of challenge is with social communication and social relationships. Okay. They don't have the language difficulties that may be characterized by, children or adults on the lower end of the spectrum. That's Asperger's, or as we now call it, high functioning autism.
Oh, okay. So it's just almost the term has changed into high functioning.
Yes, just so that it's not confusing, because a lot of the times in the past, people would kind of separate autism and Asperger's.
Ah, okay.
Yeah, as two different conditions. Well, it's actually, it's it's the same condition, but just further along the spectrum, where the functioning, as I said, is higher and more typical, if you may.
Got you. As opposed to the opposite being atypical.
Well, when I would say atypical, I think more sort of struggling with the language aspects and the social communication deficits would be more pronounced. There might be a bit more sort of that, sensory overload, the behavioral difficulties that come with these challenges that would be more pronounced on individuals lower end of the spectrum. Yeah.
And I guess a lot of the times you hear that, whether it comes to any particular condition, a lot of people's concern is it something that is passed down? Is it a hereditary thing? So is there an element of?
Yes. So autism is, based on research that we have over all these years, autism, is about 80 to 90% genetic. Oh. So, a lot of twin studies have shown that gene does get passed on. And, there are some bodies of research that also point out to environmental factors.
So like epigenetic wise.
Yes. Yeah. But okay. With autism, because it is a neurological condition, it's developmental, there's definitely a very large genetic component.
I had no idea.
Yeah.
My goodness.
Yeah. So it could be someone in the family, not necessarily, parents, but it could be anyone in the family, like, aunts, uncles, cousins. Yeah. And, especially with high functioning, that probably gets missed, like with other family members that may have it, they might be just considered, a bit quirky or, just a bit different.
Yeah.
And that gene does get passed on within families. So it is, answering your question, it is quite, hereditary and genetic. Yes.
And, I guess it's always, because you said it's on the spectrum, so there are a big variation of what potential characteristics or signs are. Yeah. But in general, what would parents be looking out for? Let's say we're specifically talking in children. Mm-hmm. What are early signs or characteristics that might be suggesting that somebody is potentially on the spectrum?
Yeah. So, with autism, as with I think any condition, early, picking up early signs do really help in sort of the treatment and the prognosis of the condition. So signs that parents would be looking out for in young children, and I'll talk about it in sort of different stages. Yeah. So with early childhood, so around that age of 2 to 5, what you typically want to see with your child is, that sound language development. So if there are challenges with their speech where they're not sort of picking up the language, or they have certain words and it's very need-based communication. So the communication is not beyond just asking for things that they need. Things like pointing things out, like, hey, mom, look, that's a yellow bus, So these children on the spectrum, these are kind of the signs that they start showing where they're not pointing things out. Gotcha. They're not, asking for that joint attention, like getting mom or dad to watch what they're doing. They might also show a preference for, being on their own, not wanting to interact with other kids. Now, depending on, how, like where we are on the spectrum, that would be very obvious. And sometimes it might not be obvious at all. Yeah. But, once they start sort of nursery and, preschool.
So preschool. Nursery and preschool.
You might start to notice sort of those difficulties in sort of forming friendships, age-appropriate friendships. And even if they do make friends, they might not know kind of how to take that friendship forward, sort of that insistence on, I want to be in charge, or, you have to play by my rules, that lack of flexibility. Oh, someone else wants to play something else, so we need to take turns. So, it's very subtle signs like that at that age. And then as we move further, along that age, with primary school or, middle school kids, it's very much centered around their peer relationships. So, they might, for example, be teased or, in that light-hearted sort of way, or sometimes even bullying, but they might not recognize that they are being teased or bullied. Yeah. So it's very much that lack of understanding, social communication, social skills. And then the other aspect of it is sort of that restricted interests. So they might have a special interest. So, a lot of the times it's dinosaurs or cars, and, they tend to have a lot more information about these areas of special interest than other kids their age, where they want to talk about it. You might not, they're talking about it so much, the other person might not really be interested, but then they're not picking up on the social cues. And so they kind of carry on. So these are some of the, signs that you might see depending on the age, age of your child. Yeah.
And so let's say, generally, do sign, they're predominantly very much on a social aspect.
Yes.
And then the language, sort of the delay in language, could that also be something you mentioned that?
Yes. So, that's one of sort of the early markers of autism, like a delayed language development. Now, it's not necessary that
it's just that.
It's just that. It could be
multitude of things,
multiple different things. Like it could be a speech and language condition. It could be sometimes even ADHD. But with, research has shown us that children that go on to have a diagnosis of autism very often have language difficulties in early childhood. Sort of, again, speaking in those full sentences, communicating beyond just, what they need. That is definitely a hallmark of the spectrum.
So it's more sort of behavioral. You'll see sort of signs, like, for example, I don't want to call them almost like characteristics, or the majority of the characteristics are behavioral.
Yes.
Okay.
Absolutely.
Okay.
Because, again, with autism, because it's a neurological condition, there isn't a way to understand that beyond the behavior, especially with early signs. So it's really how your child is developing, how are they, managing in their day-to-day sort of peer relationships at home. So these are kind of the things, their behavior, their communication that you want to be observing.
Okay. And generally, what age, what would be the sort of the minimum age that you can kind of see a certain characteristic?
So, again,
it's a difficult question.
Yes, it's a difficult question to kind of give you a two-word
finite
Yes.
answer. Yeah.
Again, because it's such a wide spectrum. With when the child is on the lower end of the spectrum. When I say lower end, I mean in terms of functioning.
Okay.
Signs might be more apparent at a very early age. Things like lack of eye contact, showing no interest in parents. Even at that sort of, just before they hit their first birthday or around the 1 to 2 years of age, they're not responding to their name. That lack of interest in their surroundings. But then, as we move further along the spectrum, closer to being neurotypical, it does get a bit more
difficult to spot.
So again, age of, when they would pick it up, it really depends on how
pronounced, I guess. Yeah.
And how much sort of parents are picking up on these, on these behaviors that the child may be displaying.
And I guess, do you guys have like I say you guys, I mean the medical community. Do you have almost like an age where diagnosis should be given, or for example, is there a too young to be diagnosed, too old, or to be diagnosed kind of thing? Is there like a proper age where children can potentially be diagnosed correctly?
Well, I will say this: there's no sort of definite age as to when a person may be diagnosed. At the clinic, we have adults coming in, to be exploring a diagnosis of ASD. So there's no right or wrong age, but I will say that the sooner we get in, the earlier we intervene, the better equipped the child is to sort of manage those difficulties that may present
later down the line.
Especially around sort of social relationships, making friends, keeping friends. If we intervene in that early age, which when I say early, I'd say probably 2 or 3 years of But if I'm speaking from an assessment perspective, we can assess a child as young as a year or even less. But personally, I wouldn't recommend that, because you want to give this child a chance to grow and develop and put in support before we try to look at it look at the child through this lens of what's wrong with you. Let's stick a label on you.
Yeah, that's right. Put the label in. So sort of do the support, the support functions as opposed to put that person in a particular label.
Exactly. Because that label doesn't really serve much of a purpose unless we know how we're going to support this child. So, with young children, I'm a strong proponent of, put in the support services like speech and language, social skills, perhaps at schools, like social support groups, things like that, and give this child a chance to kind of, show us what they're capable of, and give them a chance before we say, okay, you know what, this is impacting their functioning. They are going to benefit from a diagnosis.
I think that's really important to point out, because I think in this day and age where we as people, we're wanting almost instant gratification. We must know what's going on.
Yes.
So things like diagnosis, you want to get to the bottom of it. You want to know exactly what it is. Whereas I love the fact that you're saying that let's not stick a label just right now. Yeah. Let's support whatever needs that little bit of, that extra bit of help. And let's see how it goes, kind of thing.
Exactly. And, sometimes, especially in sort of the day and age that we live in with social media, throwing diagnoses and labels, and I have this and I have that, helps us fit into these neat little boxes.
That's right.
But
it doesn't work that way.
It doesn't, because the child is way more than just that label.
That's right. And I love how, I think it's just obviously recognized that you need to move away from just that one word of autism and having it on something as big as a spectrum, because I don't think there's any two of the same.
No. This kind of reminds me of when I was doing my training in autism, the professor, one of the things she said was, if you've met one child with autism, you've met one child with autism.
That's right. Yeah.
Just because this child presents in this way doesn't mean the next child that has that diagnosis is going to be the same. So, again, that label is for us to kind of understand in a broad way what might be some of the difficulties, what might be some of the markers, but it doesn't define this child that's come in, for an assessment or for,
It must be actually kind of, very, I'm sure you guys work very closely with other support services.
Yes.
So I think you're almost like you go in as the one-stop shop, and then you kind of branch out to whatever that child potentially needs.
So it's usually a multidisciplinary
approach, which is the best type of approaches.
Absolutely.
Yeah.
Because that, one person cannot serve all the needs that this child and their family may need, so there might be some parenting, there might be some speech and language, some support from the school. So it's really, like you say, it takes a village.
It does. It's so interesting. I feel like we can talk about that particular point for a full hour.
Oh, absolutely. I could go on and on about it.
And again, it was just, I guess, let's say, the signs usually start, you're saying that sort of characteristics can be quite young, you can pick them up at a really young age. And then sort of typical diagnosis or sticking a label on it, it can be at any stage, really.
Absolutely.
And who does the diagnosis? So let's say I'm a parent and I'm seeing certain characteristics that I'm not really aware of, whether I'm a first-time parent or parent to multiple children, but I want to get or see somebody who would be your first step?
So I would always say your child's pediatrician.
Okay.
Right? Because that is someone who's accessible, and knows your child very well. And pediatricians are trained in sort of, picking up on those milestones and, noticing if there are any anomalies. So I would say first stop would be your child's pediatrician, discussing the concerns that you have, and then they would create the referral pathway. So answering your question of who diagnoses it, usually it's a multidisciplinary team that's involved, but it would either be a developmental pediatrician, so someone who is sort of specialized in that early childhood developmental milestones, that sort of specialization, or a psychologist that is trained to diagnose autism. So you want to make sure that this person has background
with that
speciality, and if you're looking at an assessment, that this person is trained to administer that specific diagnostic tool for, to arrive at the diagnosis.
Gotcha.
And this could also be a speech and language therapist. Like speech and language therapists are also trained in that tool. But it would usually be a psychologist and a speech and language therapist.
Okay. But generally, just for parents listening, it would be consult with your pediatrician and voice your concern.
Yes. So discuss whatever you observe, whatever you think, might be sort of, if you're comparing them to your first child or whatever, or you're comparing them to their peers, discussing that with your pediatrician, and then they would be able to take that call of, okay, I see where you're going with this. We need to have this look further, and then they'll create that referral pathway for you.
Because it's a bit confusing. Yeah. You don't know, should you be researching somebody in that field in sort of more a psychology way?
Yeah.
Pediatricians, yes, you could potentially, but it is, it's that taking that first step is, number one, a bit scary, and number two, it's very confusing, I find.
Yeah.
Because there are lots of things that could potentially be involved, and especially if, let's say, for example, exactly like you said, if a child isn't speaking yet, you would think, maybe I should speak to speech and language therapist. Maybe. So it's good to know, at least that way, it gives people a bit of a direction.
Correct.
Yeah.
And it's not overwhelming to have to, see a psychologist or, see a speech and language therapist, where parents might be like, I don't know if I'm ready to kind of go with this first step. It seems really big, whereas a pediatrician seems more accessible.
And you've probably seen them many times.
And you're more comfortable with them, and they know your child really well.
Exactly. So they can kind of follow through or give you suggestions. Yeah, I'm with you. Go to the pediatrician.
Yeah.
So you always hear that sometimes things are more, noticed in certain genders. So things are more sort of pronounced in boys rather than girls. Is that the same with autism?
So with autism, I think up until very recently, we believed that autism was more prevalent in boys than girls. Like there was this ratio that was doing the rounds that for every 4 boys that are diagnosed with autism, there's 1 girl diagnosed. So it was believed to be more prevalent in boys. But in the last, I'd say 10 to 15 years, research has shown us that actually that's not the case. It's just girls were underdiagnosed. We weren't picking up girls on the spectrum as accurately as we were picking up boys on the spectrum. So there was a lot of underdiagnosis in the female population. And I think that's because girls tend to mask better. So what I mean by that is, they watch their peers communicating in sort of social situations and kind of how to do things, and they copy it. They mask. They're masking their difficulties and they're copying what they see around. And girls tend to be socially more
adaptive.
Yes. And so they were just, falling through the cracks because they were putting on this mask and making it look like they didn't have those difficulties. And so that's why girls were being underrepresented. But now we know that that's actually not the case. There is no difference in terms of prevalence.
Okay.
And, with girls, it's, you just have to be a little more careful with your lens, looking out for other markers, as opposed to just the typical sort of no eye contact or lack of interest with friends. Yeah, you're kind of digging a bit deeper into their social relationships and their understanding of social relationships, because that's where the gaps would be noticeable.
Got you.
Yeah.
That's so interesting.
Yeah.
Yeah, you would never think that.
No, like even when I'm doing an assessment, I notice when I'm with boys, it's a lot more straightforward, the assessment. But when I'm assessing girls, especially teenage girls, you do kind of have to delve deeper into, so tell me what you understand about your friendships. How do you see this one as a friend? Why is that one not a friend? So it's more about their understanding as opposed to just their behavior.
Yeah.
So that's why it gets a bit more difficult.
And you sort of have to almost dig deeper.
Yes. Yeah. And that would be one of the reasons why girls tend to be underdiagnosed or fall through the cracks.
Can I ask, just on a complete sort of on a tangent, are they coming to you because they're facing some sort of struggle in a particular area? I guess what I want to say is it something that I get not so much needs a diagnosis? Can you kind of just go with it if it's not affecting
Absolutely.
your life, I guess?
So I mean, a lot of the times, children that come to see me are not coming because of these difficulties where parents are saying, I think he or she may be on the spectrum. What do I do?
Yeah.
They come in because, they might have anxiety in social situations.
Got you. Okay.
Or, parents are concerned that, they're not really, like with the teenage child, they're not really going out. They're not, meeting their friends outside of school. They're not very happy at school. So these are kind of the concerns that they come in with. And as I'm working with the child in therapy, we start to pick up on these difficulties because they come through behavior and their understanding of the world around them. And that's usually when I say, okay, you know what? Perhaps we need, especially with teenage clients, it is a good idea to have that diagnosis because it helps this child understand why these things are difficult for them. Like, why is it harder for me to make friends or to be, for example,
keep a
spontaneous, in a relationship, or keep friendships, while everyone else my age is, doing it as if it's nothing, like it's so natural. So understanding that, okay, you know what, this is difficult for me, but hey, these are the things that I can do, which we work on in therapy, to bridge that gap. That's where a diagnosis kind of is helpful.
Giving you tools.
Yeah, on how to manage, just like with, if you're diagnosed with a physical health condition, your doctor will tell you, do this, like, your diet, your exercise, this and that. It's the same thing. Okay, this is what's going on for you, but here's how we can help improve those difficulties that you're facing.
That's really cool. It's good to know because, I mean, you generally, again, you always think sometimes, is it worthwhile going in for an assessment, or if it's something that you can just, I guess just get on with it. But I don't know. It's one of those things that if it's not potentially causing any, I guess anything negative, if it's not negatively impact your day to day. And I've met a lot of adults that have decided to explore a diagnosis at 30 or 40, and just to kind of get to the bottom of why they feel a certain way.
Exactly. And it's not even about how do I manage. It's really just I've noticed these things about me and I just want to understand myself better. And for some a label helps, for others it doesn't. So it's really depends on the family as well. I've had a lot of families, where I've worked with the child. I've said, I'm suspecting this, but I always leave it up to the family of, do you want a diagnosis or not? And some families say, you know what? Actually, we don't. We are aware of this. We understand what our child's struggling with. You can support in this way. We're happy to give them the support, but we don't want the label, and that's absolutely
fair
fine.
enough. Yeah, absolutely. It's so true. It is a personal thing.
Absolutely. And I think the family should be able to decide that,
absolutely,
as opposed to a professional telling you, no, I need you to do this.
Yeah. And I think to have the idea of having the support and getting the support where just like anything in life, that's the most important.
Yeah.
As opposed to putting that person under or in a box.
Exactly.
Of some sort.
Yeah.
And let's say parents do come in to see you, or they've been referred to you.
Yeah.
What can they expect from an initial assessment?
So the initial consultation,
just high level, I guess.
Yeah. And exactly, it would be with high functioning individuals. The initial assessment is with parents, so I don't see the child for the first sort of consultation.
It's with the parents.
It's with the parents, because I want to understand
what they're concerned about.
What their concerns are, their child's behavior. And what I'm also trying to establish is, were these difficulties seen from the get-go, like before sort of that 36-month marker, right? Because that's the other thing with autism. Because it's a developmental condition, you're born with it. You don't develop autism later on in life. You might get diagnosed later on,
but you're born
with it. Because it's a neurological condition. It's not caused by the environment or a parenting style or whatever. It is something you're born with. So I want to sort of ascertain that these difficulties that the child is presenting with right now, when the parents come in, they were sort of markers of that prior to that 2 to 3 years of age. There were certain things that parents were noticing. So a lot of the questions that I will be asking is around developmental history, social history. What are they like at school? What are they like with their friends? I want to get a full sort of understanding of this child in their environment.
Yeah.
because it wouldn't be fair for me to see the child in the clinic in a brand new environment and say, yeah, there you go, that's what's happening with you, you know. So that the first session is usually with the parents to understand that, and then I would see the child. If the parents have decided they want to go in for an assessment, we'd start the assessment process. But if not, then I, usually suggest, let me work with the child, 3 to 4 sessions where the child is comfortable, speaking with me, comfortable in the environment before we decide
what to do next.
Do we really need to go down the assessment route, or is there a different pathway that we can take?
And for you specifically, do you work with all age ranges?
So I work specifically with children and teenagers. So I start, if I'm seeing them in therapy, it would be around 5 to 6 years of age, all the way to 18.
Okay, but nothing below 5?
Nothing. Well, with assessments, I see them below 5. So like, for example, an autism assessment, I would do it with a 3-year-old. And then all the way to 18. But I don't work with adults, except if I'm doing parenting.
Got you. Okay, so you've got 2 almost arms. The parenting.
Yes, because I don't think I can support the child without working with the parents.
Yeah, which is very important.
Yeah.
And, I guess when we were talking earlier, characteristics and signs and all that type of things, it's massively exaggerated in terms of social media or the internet or somebody you speak to. And I find with autism, there's a lot of myths around it.
Yes.
Do you want to bust a few common ones?
Yes, absolutely. I think the most common, question that I get with parents, is that, my child is on the spectrum, so, that means he must be disabled. There must be some kind of, disability going on. And I think that is a huge myth, that all people on the spectrum have an intellectual disability. That's not the case. Yes, with, lower functioning individuals, an intellectual disability might present, but with the vast majority, especially the population that I work with here in the UAE, I'm yet to come across a child that I've diagnosed with autism that has an intellectual disability. So, just like with neurotypicals, children on the spectrum also have varying levels of, intellectual functioning, and some of them can actually be gifted. So I think that's a big myth, that all people on the spectrum have some kind of, intellectual disability. And I think the other one is, the child, people on the spectrum tend to be very aggressive. And I think that's also portrayed, in media, in movies and things like that they can be quite aggressive. I don't think it's any more or any less than neurotypical. And I think also understanding where that aggression comes from.
What's the trigger?
And a lot of the times it is because it's either a sensory overload or emotional distress, and they don't have the ability to express it, and so they're expressing it by hitting or kicking, much like a neurotypical child.
Absolutely. If they're dysregulated,
I
think every single toddler
exactly
exhibits that type of behavior, and it's very much normal.
And behavior is communication.
Absolutely.
So that child is just trying to tell you, I'm struggling with this. I don't know how to say it, so I'm going to show it to you.
One thing that you said before we started the interview was that it's not a disease.
Yes.
And I love that.
Yeah.
It's not something that we need to treat like a disease.
No, exactly. It's a condition, yes, but it's not a disease. It's not like there's something wrong with you. It's just a different way of being. It's just a different way that your brain functions.
That's right.
There's nothing wrong or right about that.
Yeah. Exactly. It's not, like you said, it's not a disease and it's not a disability.
No.
It's not, it's just
your brain works differently.
In a different state of being.
Yeah. And, a lot of people tend to think that autism is a mental health condition or a mental health disorder.
Also, that was another thing I was going to ask you.
Yeah. And, yes, there can be co-occurring mental health conditions with autism, like, people on the spectrum might have anxiety, might have depression, mood issues.
But that's not the disorder.
Exactly.
It's the follow-on from what...
That would be considered the mental health condition, whereas autism is a developmental condition. It has nothing to do with mental health. Not to say that they might not struggle with their mental health, but they're two separate things.
I think it's very important to highlight that.
Yeah.
Because you can potentially be treating one and leaving one out, kind of thing, if you're not understanding the difference between the two, kind of thing.
Yeah.
It's very important because, again, you just need to do a quick search on autism or have a quick look on social media. And
Yeah.
what you see and what you're explaining now is not the same.
And that's not what you get to see with Dr. Google.
Yeah.
You know, it's always sort of negative
Yeah.
information
Yeah.
that's put out there
Yeah.
with autism, and you know, people tend, and I don't blame parents for getting worried or concerned.
You do, because what you see is all the negative.
Yeah.
You don't see what, you know, when a child has had the support, when a child has gone through these certain therapies, what does it look like in terms of long term?
Yeah.
You know, that's where you get the warning signs, the red flags, the certain characteristics, and the majority of them are all negative.
Yeah.
So,
Yeah.
you know, for example, you highlighted just then that certain abilities might be termed as gifted. Things like that are left out.
Yes,
because,
absolutely.
You know,
because no
people
one wants to hear that.
No.
You know,
which is really weird.
it's terrible.
Yeah.
You know, because I do think that autism in general gets a lot of bad press.
Absolutely.
But it's really not. It's not a negative or a positive thing. It's really
it's just what it is.
It is what it is, and we just have to understand it for what it is without trying to, again, put it in a box. You know, we're okay saying, oh, I have anxiety, or oh, I have depression. That seems to be okay, but it's not okay to say, oh, I'm on the spectrum.
Yeah.
Why?
What is up with that?
Yeah. Why?
Yeah, I don't know.
You know, it's the same thing. You have diabetes, yes. You have autism, yes. It's exactly the same thing.
Absolutely. Gosh,
Yeah.
I feel like you hit the nail on the head.
Yeah.
Stop treating it as if it's a disease.
Exactly.
Yeah.
Yeah. It is literally. I know I'm repeating myself, but it's just a different way of being, and that's okay.
Yeah. Oh, I love it. I love it. That's exactly what it is. And I feel like to get the word out there, and we'll talk a little bit about your support groups, the fact that you do that and you push for that type of change in mindset, it's very important for kids, for adults, for parents, for everybody involved.
Yeah.
To not have this sort of catastrophic thing, you know, that they in their minds that, oh, it's autism. Okay. And, you know?
Yeah. And, you know, I do want to point out, like, again, when I'm talking about this, I'm talking about sort of the high functioning
I got you. Yeah,
individuals,
I got you.
you know, parents that have children that are on the lower end of the spectrum, like low functioning. It is very challenging. You know, there can be quite a lot of challenging presentations.
Yeah.
But then again, there's nothing wrong with the child.
No.
You know, it's just we just need to know, what are they struggling with? What supports can we put in place to help reduce the distress that this child is facing?
Yeah. Oh, goodness. I feel like, again, something that we can talk about for hours.
Yeah.
I have to ask, just because I think this is sometimes something that people always wonder about, but risk factors for autism, whether that's in pregnancy or in early childhood.
Yeah.
Anything that again, I never want to talk about it in the sense that you as a pregnant person can do to avoid certain things that might bring on a potential autism diagnosis or something like that. Is there anything risk factors that we can touch on?
I don't have a list because, again, we don't know what causes autism. Like, we know all of this information about autism, but we're still trying, when I say we, researchers are still trying to figure out what causes autism. And we don't have like one reason or two reasons that cause autism, right? So in terms of that prenatal health, you know, it is, research has shown that, you know, taking your supplements and sort of that general pregnancy guidelines, that definitely reduces the risk.
Okay.
And there's some research, not a lot, but there is some research that supports the age of the parents as well.
It's funny you say parents, both women and men.
Yes, and in fact, the age of the mother is important, but again, the age of the father as well. So, you know, much older father would also, you know,
that's so interesting you said that.
Yeah.
There's a majority of people will always look to the mother's age. Yeah. And that's always something that's in question, isn't it?
Absolutely.
Not in this case.
Yeah. No, it's both parents, you know, their age, and of course both parents' health as well.
Yeah. Yeah,
you know,
I got you.
There isn't a single sort of thing that I can tell you.
Put your finger on.
Yeah, that if you do this, it won't happen. And, you know, you mentioned early childhood as well, risk factors. And, you know, like I said earlier, you know, an infant is born with autism. So in terms of risk factors with early childhood, there's nothing that you could or couldn't do that would make avoid it. Like if the child is born with it, it is going to be there for life. You're not gonna cure it.
Cure it. That was my next question. Can it be prevented or cured?
Again,
or cured, and I say that in air marks.
When we say cured, again, we're looking at it as a disease.
Yeah.
And it isn't a disease. Can it be managed? Absolutely. Can we, give these individuals sort of those adaptive skills to manage and, in their social life, in their, work life, at school?
Yeah.
Absolutely. Yeah. There are things that we can do to support and skill up the child. But just because we've done this, does it mean 10 years down the line they won't be on the spectrum? No. They will continue being on the spectrum. They can move. Like if a child is on slightly lower end, we can skill up that child and bring them up to a higher level of functioning. But that diagnosis will
always
be there.
Remain.
Yeah.
And I think now, I guess, even in my generation, and I'm only obviously more aware of it because I've had kids, you have seen a rise. There is a rise. Is it that there is a rise, or is it that there's better, I guess, again, we're using the word diagnosis, but is there better tools to diagnose?
I think that's what it is.
Okay.
So, autism, there's some work showing that autism was described in the 1700s.
Okay.
We started defining it and diagnosing it as autism as early as 1940s.
Oh, wow.
Right?
Okay.
But now there's just so much of research in this area, and so we've just gotten better at picking it up and identifying individuals on the spectrum. So that's why there is that rise. But I think it has always been around, but we're just looking at it more accurately, more closely, and better able to pick up and support children or adults on the spectrum.
Ultimately, that's what you want, to be able to support.
Yes.
So that they don't have difficulties down the line.
Exactly. So that they're able, because they're aware of their difficulties. That's where kind of that anxiety and depression and things like that come, because they're aware of, okay, I struggle to make friends, for example. But if we can offer that support and teach them, how do we make friends? How do we sort of communicate in groups and things like that? If we can teach them these skills that perhaps you and I take for granted,
that's right.
If we can teach them that, then we're giving them a better chance at these relationships as they grow older.
Yeah. So funny you said, did you say 1400s that they...
Yeah, 1940. 1940s is when they started using the term.
But then even way before...
1700s,
Things like, for example, like Beethoven, Picasso, all these massive like geniuses that were always a little bit... Again, you would probably use the word quirky.
Yeah, and we know Albert Einstein was on the spectrum.
Yeah, and all of these, these big, sort of, figures in our history that about their troubled past, but they've also produced brilliant,
amazing work.
Yeah, it's funny, and it's as we sort of progress in the years and technology, and it's good to be aware, and just to lighten the load. Life is not that easy.
Yeah,
and to have somebody support you through things that you may not understand why is happening.
Yeah,
it's very important to have that type of network where people can feel, okay, let's say this person has potentially told me, oh, this is why this child has said this to me, and I understand, and I'm going to say that to them, and it's you take it with you to the workplace, you take that with you to your personal relationship, so it's important.
It's super important, being able to ask and receive that support. Yeah.
Gosh. So much to it. I have to bring you on again.
Absolutely. I'd love to.
This one is a little controversial.
Okay.
And I'm pretty sure some people are going to be like, oh my God, what is she asking?
Yeah.
Only because I keep reading it.
Yes.
And of course, doing a search, which I did, of course.
Yeah.
About vaccines.
That is a big one. And, I'm...
Vaccines and autism.
Yeah.
Is it at all interlinked?
Well, I think that study...
I don't expect you to full on get into the sort of crux of it, but just, it is something that people say, oh no, don't take that because it's going to cause autism, or oh, don't be silly, that doesn't do that. But people don't really...
They don't really know. Yeah. And, what interests me is there was one study that linked the MMR vaccine
and it went viral.
To autism, and that went viral. Yeah. And there have been, I don't even have a count, like hundreds of studies after that have shown that there is no link.
Okay.
And yet that one study, because it was popularized so much by, again, a vaccine producing company, has created this myth. And absolutely, there is no link between specifically the MMR vaccine and autism. I have met quite a few children that are on the spectrum and haven't taken the vaccine. And I've met thousands of children that have taken the vaccine and are not on the spectrum. So there is absolutely no research, no evidence apart from that one study that links.
It's good to know.
Yeah,
it's good to bring.
So you do the math.
Yeah. So it's in your hands, but this is the reality.
Yes. Yeah. Exactly.
Of course, we just touched on it very, very briefly, but you do incredible work within your community in terms of a support group.
Yes.
You offer the support group to parents and children, or mostly to parents?
So it's parents.
Okay.
I run a monthly free support group through the Lighthouse Arabia. Yeah. It's online at the moment. I think that makes it a bit more accessible.
It is. I think lots of parents prefer online these days.
Yeah. So it's a support group for parents that have children on the spectrum. So it's like a little community. We usually have about 6 to 10 parents joining in. Of course, we're open to more, but it's a safe space. Where parents can support each other, through the journey. And, each time I run the group, there are parents that are at different parts of the journey. Either they've just had their child diagnosed, or they're considering a diagnosis for their child, or they've had a child that's on the spectrum that's, like 15, 16, and they've had the diagnosis for many years. So it's really a community of supporting each other, sharing what's difficult, picking up on things that may have worked for somebody else. And I try not to step in too much, because I think parents are the experts, of their
Sharing
children.
Experiences is very powerful.
Exactly.
That's so lovely.
Yeah, and also feeling like you're not alone. There are other parents on this same journey as you at different points maybe. And so, offering that support to each other.
That's brilliant. And you do it once a month? Yeah,
we do it once a month. It runs on the last Wednesday of each month. And they can, if you'd like to sign up, it's on our Lighthouse Arabia website.
So I'll link it in.
Perfect.
And is it like a form or something that you
so they just click it, put in their details, and then they're automatically added to the group, and they're sent the link, I think, a day before.
Oh, amazing.
And it runs for an hour, 6 to 7 p.m. on the last Wednesday of each month.
Perfect.
Yeah.
And anyone can join, potentially?
Anybody, as long as your child... So it's for parents of children. So it's 18 and below. The child has to be 18 and below.
Gotcha.
And it's for parents. So either parent can join, both parents can join. Yeah.
That's amazing.
Yeah, I hope I'm able to sort of, offer that little bit of... That venue for parents to get together. Because it's one thing reaching out to professionals for support.
Absolutely.
But also just having someone else on that same journey.
That's
as
the thing. To be able to listen to other parents, because ultimately you feel this almost connection.
Yeah.
And with all due respect, of course, within the expert community, they're experts and you need them. But to have somebody that you can almost identify with, another parent, a child is potentially going through the same thing, it's way more impactful.
Absolutely. And like I said, you are the expert of your child.
Yes.
And so being able to share that resource with other parents, I think, I hope that is really helpful as a resource for parents.
It is. That's why I was blown away by the fact that you do this every month, and to basically all parents potentially.
Yeah.
Oh, let's get the word out there.
Yes, that would be great.
Support the cause. Yeah, it's amazing. Well done.
Thank you.
I'm sure that takes a lot out of your already jam-packed schedule.
It's an hour a month, so I feel like it's my way of giving back.
Yeah, that's brilliant. That is absolutely brilliant. One of my second last question is your potential 3 tips to parents. I guess going through a potential diagnosis.
Okay, so
or 2 tips, or any high level. What's your best advice?
So I wouldn't want to look at it specifically through that lens of diagnosis. I'd like it to keep it a bit more general. And I will say, parenting a child with autism doesn't have to look very different to parenting a child. But I think kind of what I'd like to highlight is, the kind of difficulties that children on the spectrum may have. That's kind of where the parenting needs to focus a little bit more on. So, for example, like children on the spectrum may struggle with that flexibility. Sudden changes to their routine may make them quite anxious, quite nervous about it. So, things like prepping them for those changes. Like let's say you know that their homeroom teacher is not going to be at school tomorrow because she's out sick. There's going to be a substitute teacher. Letting your child know that, like something as simple as, hey, Miss so-and-so is not going to be in class tomorrow. There's going to be another substitute teacher. And then kind of explaining to them how that may be different, because that's also something that children may, not necessarily know what changes do I expect. So preparing them for changes.
Giving them a heads up. I love a heads up.
Exactly. Right? Like I want to know if a client is not coming. I'd like to know in advance they're not coming.
Or if there's a change in the schedule or something is off.
Yeah.
I mean, I am very routine based as a human being.
There you go.
So anything off my routine, it does kind of...
It throws you off a little bit.
Yeah.
So, and that's why I like to say that it's not necessarily just for children on the spectrum, but I think they're just a little more sensitive to those changes than a neurotypical child would be. Yeah. And also, I think, again, this goes for all children, that connection that you have with your child, that rapport, right? Being able to meet them where they're at and giving them what they need, in terms of whether it's that containment, whether it's that reassurance, or sometimes it's just give them their space. If they prefer to be on their own for some time after school because they're overloaded from the social interaction, let them have that space.
Absolutely. Don't take it personal.
Exactly. Exactly. It's not about you. It's they need that downtime to kind of decompress after all those social interactions for all those hours at school.
I hear you.
And I feel like that after work. I don't want to talk to anyone when I get home.
Me too.
So why not afford them that as well? And then specifically with diagnosis, what I would say is, going in with that open mindset of the reason and understanding, why am I getting this diagnosis? Is it just so I can say my child has this and it helps me understand my child better? Or is it because I want to know how am I going to support this child further? It's going to help me understand this diagnosis on a deeper level, and give that child the support that it needs. Because sticking a label is easy. Anyone can do it. But what are you going to do after that? Once that assessment is done.
Don't focus so much on the label.
Yeah, that's a process. But, what comes after that? The support. I think that's where, as parents, the emphasis really needs to be. And it's in your place to ask the person that's diagnosing, okay, you've told me all of this.
Great, yeah.
But what do I need to be doing next? And that's their responsibility to be guiding you in that area and helping you put those supports in place. So as a parent, advocating for your child, what do I do next?
I think that's, advocating for your child.
Yeah.
Keeping an open mind. Don't be so concerned about the diagnosis.
Yeah, and it's nothing to be afraid of.
No.
It's really just a tool to help you understand this child better.
Yeah. Brilliant. It's so, I mean, you've said it so beautifully, and it really, in a very... almost like I generally feel, that you've just calmed it all down. Yeah. All that chaos and noise around it. And you're like, no, just take a second. Like, just calm down. This is not the be-all and end-all,
No, it isn't. It is... Yeah, there's so much more that you can learn and, help with your child. It's not a sentence.
Yeah, absolutely.
Gosh,
it's the end. It's the end. I've got time. I've got almost like a 60-second window, a 60-minute window. And I'm like, we've got time constraint. But usually at the end of each interview or episode, or I usually start it with a little quote and I try to end it with a quote, but from my wonderful, wonderful guests. So if you've got one for us today, I would love to hear it.
I do. I'm going to pull up my phone.
Yes, please. It's a bit of a long
memory.
one.
Yes. So, I think this does apply to what we were speaking about, but I also think on an individual level, on a broader spectrum, if each one of us could kind of try and, live by or implement this in any way. So it's by Brené Brown. True belonging only happens when we present our authentic, imperfect selves to the world. Our sense of belonging can never be greater than our level of self-acceptance.
It's beautiful and so fitting.
Yeah.
That's absolutely perfect. I'm going to list all of your details.
Okay.
Of course, I'm going to put Lighthouse Arabia.
Sure.
If anybody wants to sort of see you for a consultation, they can do it through either the website or give the center a call.
Yes, absolutely.
And then I'll also link your support group as
that
well.
would be perfect.
Thank you so much.
Thank you for having me and giving me this platform.
Oh, it's my
to be
absolute
able to
pleasure.
reach parents. Yeah,
it's my pleasure. What you're doing is incredible, and keep doing it, because people need this. To be able to understand that this is not something that you should be afraid of, not something that you should be worried about to such an extent. It's, just love what you said, that it's just a state of being.
It really is.
Yeah,
it's no different to how everybody else is.
Yeah.
Yeah.
Thank you so much for being here, and thank you for your time.
Thank you for having me. It was such a pleasure.
My pleasure. Thank you so much. They say it takes a village. I hope you enjoyed today's episode. I look forward to bringing you another one next week. Don't forget, please subscribe, rate, and review so I can reach and help even more parents. And if you've got a topic that you'd like me to cover, please head over to my Instagram page, ittakesavillage.me, and drop me a line.